I'm Laura Pankowski and I'm going to do a sterile wound dressing change. So the first thing I'm going to do is I'm going to assess my patient's chart. After doing so, I'm going to perform hand hygiene and put on the appropriate PPE. I'm going to walk into the room and I'm going to check my patient's ID band. Hi, my name is Laura. I'm going to be your nurse today. Is it okay that I check your ID band?
Sure, go ahead.
Could you tell me your name and your date of birth?
My name is Brittany Zavala. My date of birth is April 26, 1998.
Thank you so much. After that, I'm going to make sure that my patient isn't in any pain before I do the procedure. Are you in any pain today?
Nope.
Okay. If she was, I would go and I would get her medication, and then I'd wait about 30 minutes to let that medication work before I would do the dressing change. The next thing I'm going to do is I'm going to raise the bed for her. If she was in a bed, it would be about up to my elbow length. So I'd raise the bed and check for any drains to make sure nothing's in my way. Are you at a comfortable height?
Yeah.
Okay, great. The next thing I'm going to do is I'm going to close the curtain and shut the door for privacy sake. Then I'm going to change her dressing and I'm going to explain what I'm going to do. So we're just going to change your sterile wound dressing today. I'm going to throw this one out and I'm going to put a new one on you, okay?
Okay.
All right. So I'm going to put clean gloves on. And then I'm going to use the push-pull method to remove it. Let me know if you're in any pain, okay?
Okay.
Okay. Once I remove that, I'm going to check the bandage itself for any kind of coloration, any kind of clots, any smell, and I'm going to document that down in my findings. I'm going to dispose of that in a red waste bin, and I'm also going to dispose of my clean gloves. I'm going to use my little ruler to measure her wound itself. And I'm going to take note of that as well. After taking note and doing so, I'm going to set up my sterile field. Now, since we're outside, in reality, I wouldn't place anything on top of my sterile field. Right now, I might place something down just to hold it from the wind. I'm going to open everything away from me. And without touching the white portion, I'm going to bring it out. And I'm going to lay it down. Like I said, I'm just going to place this here so that my sterile wound, my area doesn't fly away like you just seen. So we're just going to fix it and we're going to put something else on top of it for the time being. That wouldn't happen in real life. Then I'm going to open everything else away from me, and 6 inches above, I'm going to drop it, avoiding the two ends. We're going to save this so that when I irrigate, I have a place for the saline to go into. We're actually going to save this, and we're going to put the saline into it. And the wind has already blown my sterile field over again. So I'm just going to place something else down on it so that I don't have this issue. I'm going to open this away from myself and dump that on there as well. And then we're going to just kind of purse this up so that once my gloves are on, I'm not going to touch it. And then I'm going to place my medication on here as well. The next thing I'm going to do is I'm going to put on my sterile gloves. I'm actually going to wash my hands before I put my sterile gloves on, in between the dressing change and doing this. So I wash my hands, I come back. The wind's a little brutal right now. now that that's done, I can actually start doing the wound chain. So I'm just going to organize my space a little bit better. And now since I've drawn this up, I'm going to place this into here, and I'm going to irrigate her wound. And I want to do that until there's no more color. So once it's clear, and then I'm going to throw this away. And then I'm going to, with my sterile hand, take the dry gauze, and I'm going to dab, making sure that my sterile hand does not touch the wound itself. So this is my clean and my sterile. I'm going to throw that out. The next thing I'm going to do is I'm going to take that alcohol wipe, I'm going to crouton that up, and I'm going to go around the wound and dispose of it. Then if there's any medication that's ordered, I'm going to take this, grab some medication, and I'm going to put that in the wound and dispose of it. Then I'm going to take the wet gauze with my sterile hand, squeeze out any remaining saline, and then I'm going to take that other Q-tip with my sterile hand, pass it to my clean hand, and this would be placed inside the wound. Then with my sterile hand, I'm going to take a dry gauze and place that on top, hold it with my clean hand. Now, when I place this abdominal pad, both of my hands will be considered clean. I can toss this away. And now I'm going to take the tape that I've already previously set, and I'm going to window. So I'm going to place some here. And then once the bandage is set, I'm going to take the date that I wrote, the time, and my initials, and place that on top. The next thing I'm going to do is I'm going to dispose of everything that was being used. I'm going to throw that away, clean up my tape, toss out my saline, throw that in the garbage, throw everything out, remove my sterile gloves, toss those away as well. I'm going to remove my PPE, and I'm going to wash my hands, and then everything is all set.